Hello, I am Shasi, and this is episode number 53 of the Silverfox podcast. And like I always say at the beginning of each podcast, go ahead and press on subscribe at the end of the podcast if you haven't already done so. We are everywhere on Spotify, YouTube even, and Apple Podcast and every other podcast platforms. Now today, my next guest on today's episode is someone who is pretty well known in the Singapore Premier League fraternity because he plays an important role, let's just say, in a sports person's physical well-being. He could prove to be the difference between a sports person coming back into the game quickly or even prolonging a career. My guest is a physiotherapist specializing in sports physiotherapy. Now, he has been in this business since 1997. That's like more than 2 decades. He has been around long enough that many sportsmen and women, and footballers in particular, will know him. Currently, he is the Clinical Director and Sports Physiotherapist at PhysioSports Pte Ltd. Welcome to the Silverfox podcast, Mr. Fairuuz.
Thank you, Sashi. It's been a long time since we meet.
When was the last time we met? Oh, sorry. When was the first time we met?
I think either was it still at Mount Alvernia?
I think it was Alexandra
Hospital.
1999.
Yes. So I started
1997, right?
1997.
Right.
Yeah, in Alexandra Hospital.
Right.
At that time, where were you playing for? Who was you playing for?
I was playing for Clementi Khalsa.
Clementi Khalsa. Yes.
Right.
Yes.
No. Let's start off. Right, let's start off with your early beginnings as well.
Yep.
You know, I think because you and the other physiotherapists in the business as well play a very, very important role. But let's go back to you and going back to your schooling days, right?
Yeah.
In primary and secondary schools. Were you really into science? Because physiotherapy and you know, sports science and stuff like that, it's really science based.
Yeah. So I mean, since secondary and in junior college, so I'm more inclined towards science-based subjects. So especially biology and chemistry. And I mean, of course, when you are young, at that time I probably do not know what physio is all about. Okay, my inclination is more towards to go into medical, so into medicine.
Even at that age.
That was when I was like in primary 6, secondary.
Wow.
Yeah.
Okay.
So I think we come from a family who always put the importance of education.
Nice.
Okay, and that's why I think one of my earlier ambition was to become a doctor. Yeah.
Wow. Was that? But why doctor? What brought you to that? What sparked your interest rather?
Okay, I think because we have a big family, especially from my mom's
side. How big?
My mom's side. My mom has 17 siblings.
Your mom's side?
Yes, my mom's side has 17 siblings. So I have a lot of uncles and aunties, but I think what triggers me to go towards more medical at that point of time is not physio but more medicine is because I think my grandma passed away from cancer.
Okay.
And a few other uncles also have cancer.
Right.
So I think that was something that made me inclined to go towards medicine to help.
Nice, very good. But how about you? How many siblings do you have?
No, I have one younger brother.
Okay.
And 2 younger sisters.
Are they in somewhere?
They're all different field. My brother is a chef.
Wow.
Yeah, and my younger sister is working in a bank, and the other sister is working in government sector.
Nice. And sports-wise, did you play any sports in primary and secondary schools?
In primary, not really. Okay, because I came from the school is no longer there. Telok Blangah Primary and Jago Primary. Yeah, it's just a small school. But in secondary, I was from Newtown Secondary, and I played soccer for the C Division.
Newtown was in Clementi, is it?
Newtown was near Tanglin Hall.
Tanglin Hall, right?
Queenstown, yeah. And then when I was Sec 1, Sec 2 in Newtown, Sec 3 and Sec 4, I was at Tampines Secondary.
Okay.
Tampines Secondary was quite a strong they have a strong soccer team.
Okay.
So I am not too good to be able to do that, go into the team.
Right.
Yeah, but just for fun only.
Okay.
And then in college, I was playing hockey for my college.
Nice. And you talk about college, right? You went to Tampines JC.
Tampines Junior College.
How was the experience there? So by then, right? I mean, your grasp of the science and
Yes.
bio should have been there. So did you do bio in secondary school as well?
Yes, I mean, I do bio in secondary school, and I also do biology and chemistry in JC.
Right.
So
did you do well?
That's like, I really wanted to go into that medical line.
Right,
so these are the subjects that probably will help me. But sadly enough, I didn't do very well during A level.
Okay.
Yeah, so I didn't do very well. I didn't get good marks, and I couldn't get into medicine in Singapore. Okay, and I even can't go overseas at that time. I mean, the other option was to do medicine in Australia. Okay, but we are not from a well-off family, so I think the next best step is actually to go into physio.
Right. And I also wanted to ask you this, right? Why did you do your A's and then going on to a diploma, right?
Yes.
So probably that's one of the reasons as well. Why and
before that, maybe a short story on why I decided to do physio. Okay. And at that time, I think when I was younger, physio was not a big thing.
Yeah.
And nobody knows what physiotherapy is and all stuff. But I love to watch soccer. Okay, by the way, I'm a Spurs fan, Tottenham Hotspur fan since 1978.
Come on, Fairuuz.
So it's Steve Archibald and Adilas and stuff. So when you watch soccer, right, sometimes when the players get injured in the field, and then you got somebody come in, they spray, and then the players get up and start playing again. So that makes me wonder who these people are.
And it's they call it the magic spray.
Yes, the magic spray. So.
Right.
And from there on, I do a bit of reading and stuff. So they're actually physiotherapists, and that's what make me thinking, okay, maybe I can be a doctor. Let's go into physiotherapy and then see how it goes.
It's a very good point. I have two questions for you. Since you are a physiotherapist, a fully fledged, qualified physiotherapist. Number one question is, so those guys in the EPL, I'm just asking about his EPL, who goes in and treats the players on the pitch, are they physiotherapists?
They are physiotherapists.
Right. That's the first question. We'll go to that later on. You speak about this. Number two, what is in that magic spray?
Okay, it's just actually some painkillers, and then in a spray kind of it's cooling. So, when you have knocks and sprains, so when you put something a bit cooling, you feel a bit better. And then I think the other thing is also because you are still playing, and adrenaline is pumping, so you don't really think about it, and then just carry on.
It is more like it numbs the pain, and that's it.
Numbed. Yes, that's right.
And you know what? Because I've gone through this a lot, right? And right after the game, maybe at night,
you feel all the soreness and stuff.
It's ridiculous.
Yeah. So I think recently, if I'm not wrong, I think one of the athlete players, I think he has a fractured toe or something.
Okay.
And then because of the adrenaline and stuff, he keep on playing.
Okay. With the spray.
With the spray and probably some ice cooling, and he played and he lost the game. And the next day they found out that he has a fracture toe.
Was this year?
This year.
Wow. Okay. And we won't want to mention the clubs and stuff. But So that is a good way of putting it, right? It just numbs the pain.
Correct.
Without really treating the problem.
Yeah.
Right. But with all our sports people, and I'm not talking about Singapore, I'm talking about sports people in general. We just go.
Yes, of course.
We don't want to think about anything. As long as we can run, we just go, right?
True. Yeah.
Right. And this is very interesting, right? Because I've had guests on my show, and most of them at your age, when you were, I don't know, primary, secondary school, they didn't exactly know what they wanted to do.
True.
And I was like that as well. I didn't know exactly what I want to do. And you are a little bit different, right? Because you already knew at that time, okay, maybe medicine.
Yes.
If you can't, then obviously something along that line, and physiotherapy. Right. Well done. It's a good thing as well. Now, did you at that time, when you were already thinking of physio and stuff like that, did you want to be a general physiotherapist, or you really wanted to get into the sports side of things?
Okay, as I mentioned, at that time, because physios is there's a lot of branches.
Correct.
So you have physios who specialize in stroke cases. You have physios who specialize in musculoskeletal joint. You have physios who specialize in women's health, in pediatrics and stuff.
Okay.
So when I first started, okay, we actually I was actually bonded by Ministry of Health.
Okay.
For 3 years, so they actually pay. I mean, like they give us some allowance when we are studying.
This is for your diploma.
Yes,
Right.
diploma.
Okay.
So, okay. So before that, maybe what I would like to say is that in Singapore at that time there is no bachelor degree in physiotherapy.
Okay.
So there's only diploma in physiotherapy, and that is by Nanyang Poly, offered by Nanyang Polytechnic. Now, the other thing is that this diploma in physiotherapy only takes A-level students. Yeah. So I was doing my A-levels.
Yes,
so and because I cannot get into any universities and stuff, so that's where I go into diploma in physiotherapy. It's a 3 years course.
Yep.
Okay. However, it's actually because at that time they take the modules from University of Curtin University.
Okay.
So in Curtin University in Australia, they were doing the same course for 4 years.
Okay.
And they give the students bachelor in physiotherapy.
Okay.
But in Singapore, they take the whole course. They do it in has a diploma, and then we are only given 3 years.
Diploma.
To do it 3 years and diploma only.
So by right, when you did your diploma course in Singapore, it's actually a bachelor's degree content.
Yes, in Perth. In Curtin in Perth.
That's amazing, right?
So I think that was bring up some unhappiness among us.
I see.
Because 4 years course, you compact it into 3 years course, and then at the end of the day, we just get a diploma.
Okay. So is it different right now?
Yes, it's totally different right now.
So how is it right now?
Okay, now everything is there's no more diploma by Nanyang Poly.
Okay.
It's a bachelor degree by Singapore Institute of Technology (SIT).
So you go in there after A levels, or you can go from?
No, you can go straight from A levels to do the bachelor degree.
Okay.
I think they also accept some mature students who have other degrees who would like to change their profession.
Right. Understand. So, with your diploma, obviously, right?
Yeah.
You can't be a physiotherapist.
No, actually,
at that time.
The diploma of physiotherapy already entitled you to become a physiotherapist.
Okay.
So, when I was in Alexandra Hospital, I'm already a junior physiotherapist.
Nice.
Yeah.
Nice. So you were at the Alexandra Hospital after getting your diploma, right?
Yes.
You were a health therapist.
Yes.
What does that mean?
It's actually just grading.
Okay.
But we are actually under physiotherapy. So health therapists can be physiotherapy, can be occupational therapy, can even be the radiographer. But we fall under this health therapist. But actually at that time I'm already a physiotherapist.
Okay. So when you were at Alexandra, were you at the sports department already?
Okay. When we started, we always have 6 months rotation.
Okay.
So every 6 months we'll be rotated to the wards, to the ICU, to medical wards, surgical wards, and to the outpatient department.
Okay.
So we get rotated and we see different cases. So for the first 3 years, I was seeing like different kind of things. Yeah.
Is there any favorite department?
Of course, it's musculoskeletal, orthopedics, and joints lah. So I'm more inclined into like orthopedic stuff.
Okay.
So if you have known, I think that's where my first where I met Dr. To Kamsan.
The legend.
Mr. Fixer or something they call it. Mr. Fix-It.
Yes.
Yeah.
Wonderful. We've got stories of Dr. To. Players, myself, I think we've got stories of Dr. To. But it's very interesting. And you went around, like you said, a rotational thing.
Yes.
You must have seen some really crazy stuff.
Yes, of course. I mean, at that time I see a lot of like accidents. People who get involved into accidents. Foreign workers who fell down from the buildings that they were working on, so they have like fractured spine,
fractured spine.
Yeah, so they have fractured spine. They have fractured hips and all that. So it actually quite good because it give us a whole idea, and it give us a kind of experience. So you don't only look into like sports injury per se. you are actually looking like so many kind of injuries, and it gives you a lot of experience.
Nice. And I like I said before, right, I think that was probably the first time I met you in 1999 when I had an injury. I went over, and then you were there with I think Dr. To was there.
Yes, and another Eugene King. Yes. So the three of us. Yes, Eugene.
Yeah. So when you went over and started out, right? This obviously is your first start in terms of working out or working in at Alexandra Hospital, right? Did it then further reinforce the fact that this is what I'm going to do, I love it, obviously you see some crazy stuff which normal people wouldn't like to see. It's crazy, right? Did it reinforce the fact?
Yes, of course. It just makes me wanting to go into more sports physios and stuff. But I also must mention that actually, even before I started work, when I was a physiotherapy student in Nanyang Poly, one of my lecturer was, I don't know whether you know him. He's the national physio. I mean, he's the physio for the national team at that time. Andrew Stevens.
No, I don't.
Yeah. So he was working with the national team at that time, and then that's where he introduced me to Malik Awab, to the late Burhan Abu Sama, and all these people, because they actually came for some treatment in the poly, and we were helping to treat. So that's one. Then after that, while doing my diploma, I was fortunate enough to be. I mean, we have what we call clinical placement, where we go to the hospitals.
It's like attachment.
Yeah. Okay. And I was lucky enough at that time I was attached to the Singapore Sports Council.
Nice.
So at that time I think it was Sarata.
Yes.
Sarata. Karen Ko was my senior. And Karen Ko was there. Shwika, my senior, was also there. And these people actually, I think I also must thank them, because they actually opened my eyes on sports rehab, sports physios, and that's where actually makes me wanted to do this line even more.
Beautiful. Now, obviously, after your time at Alexandra, you went to do your bachelor's degree.
Yes, actually, as I mentioned earlier, we were quite frustrated because we did the 3 years diploma course and get a diploma. So while I'm still working at Alexandra Hospital, so there's this conversion degree. Okay, this is done by Singapore General Hospital, but under Curtin Uni.
Okay.
So we do a few modules for a year.
Nice.
And then we get our degree conversion.
Beautiful. I think that's the best, isn't it? And obviously you had some modules taken off as well, right?
Yes.
So listen, what kind of modules did you do when you were doing your bachelor's? The different kinds of modules.
Okay. I think apart from sports science, like a lot of people are doing and all that, we also do a lot of anatomy.
Okay.
Physiology. Okay. Biomechanics and stuff. Okay, but there are also what we call physiotherapy modules, like peripheral mobilization, spinal mobilizations and stuff. So it's a little bit different from your normal sports science, but because they are what we call the manual techniques that you learn for physiotherapy.
Nice. And I think this is good knowledge as well for people who might want to take up physiotherapy, because it's very specialized. Because once you get in, you get in, right? Unless you want to have a change in career, then you got to really reboot. And the modules are pretty similar in terms of certain foundation ones with the sports science one. And it's very interesting as well. Now, how different is it, right, from the real work that you do when you were studying? Like let's say you're doing your modules and stuff. Does it, is it similar when you're going out into the real world and facing a problem, for example, an injury?
Of course, I mean, like when you're studying and stuff, you are always rely on books,
right?
Okay, and the books will say that, okay, for example, for back pain, these are the things that you have to look out for, and these are the things that the patients will show signs or symptoms. But when you go out of the adult world, I mean, when you go out into the real world, into the hospital settings and all that, they can actually present you with some other things, which is not really, it's not straightforward. Sometimes it does, but it also makes you think.
Right.
Because maybe like you can have a back pain, I can have a back pain, but we actually show different kind of signs and symptoms.
Okay.
So that's where from experience you learn, and that's where from experience you learn how to manage. Okay, not everybody is the same for the same condition.
Yes. It's very true, right? And I think it's similar with other walks of life as well. You know, sometimes you go through attachments or whatever, but then nothing beats experience.
True.
Because after a while, you through experience, then only I think you will know what to do exactly. You know, it's a very good point.
Very true.
We will talk about your work, you know, when you first started out, you know, in a bit, right?
Yep.
You did your master in physiotherapy in 2009.
Yes.
Right? And at the University of Melbourne. So did you go over there?
So
how was the experience?
I think that was one of the best time of my life, because when I went to Melbourne to do my masters in 2009, I already worked for about maybe close to 12 years.
True.
Okay. So I think at that point of time, normally it keeps you thinking what's next in your life. Okay. It also sometimes you are overworked. Okay, you're burnt out. You just need to go somewhere to recharge. I think that's a good point. I think at that point I need to do something to recharge, and I think I'm quite happy that Mount Avenir allows me to go, and it proved to me a big eye opener.
Why?
Okay, why? Because when I go there, most of the lecturers in master course are actually either master holders or they are actually a PhD holders or doctorate, and they are very experienced. Okay, and they bring to a class not only what is taught in the books but from their own experience, and that's where you really learn a lot. And in master class, most of my classmates, they already have like maybe 5-6 years experience. Okay, so they share their experiences also, and it's a very good learning process, and we really share a lot of things, and I was very happy at the time. And the other point why I say it's an eye opener, because in Melbourne, you know, they are into sports. Everybody wants to do sports. From the kids to the old grandma, grandpa, they have to do something. Okay. Unlike at that time when Asian, we are a little bit passive. Okay, when we are injured, sometimes we say we should rest and all that. Okay, and then when the doctor says that, oh, maybe you should stop running, or you should stop doing your sports, and then you say, okay, that's it. But these people, they really wants to get better. They really wants to enjoy life, and one of the things that they do to enjoy life is to engage in sports.
Right.
So it's a different mentality. And I think the other thing that really opens up was, I mean, of course, in Singapore, I'm seeing a lot of football players, soccer especially. But when I was there, I was attached to this rugby league club called the Melbourne Storm. Okay. And that's really an eye-opener because they are so professional.
Right.
Okay, so if you want me to elaborate a little bit, it's like just for the first team, they have 2 physiotherapists in charge. They have like maybe 3 or 4 trainers. Okay. And they actually will be in the stadium from morning until afternoon. So that means morning they will do stretches. Okay, they will stretch and stuff. Then they will start to go to the gym. They will have a breakfast, and then they start at noon. At noon they start training with the ball and all that. So and then whenever they get injured, they have the physios there all the time to take care of them. And after match or game, the next day, every one of them have one sports monsieur attached.
Every player.
So it's one player to one sports monsieur. So the whole department will be like players having massage and all that. And that's where we didn't see at that time in Singapore.
At that time, I don't think we have it now also, my friend. So I think by just doing that, by going abroad and you know, opening or you know, your horizons, right? It is a big eye opener because you learn things that you think, wow, this should be done in here, but it's not happening, right? And now, just looking at the general picture, what did the masters do for you in terms of progression? Like, I don't know, higher salary, a better chance of progression to, what did you do for you?
I think at the time, I can't remember whether I have any salary increase, but probably a little bit. But with that master degree, I tend to look things a little bit different.
Okay.
For example, like if you come with a knee pain, for example, I don't only actually look at your knee. I will look at your back. I will look at your hip and stuff. And sometimes it does happens when someone's injuries is actually they have the symptoms in the knee, but it's actually coming from the back and stuff.
Right.
So it makes you to be better off.
Right.
So that means you don't just treat the knee, you treat other places that can cause the knee pain. And I think with the master course also, I think I do some teaching at NYP also.
Nice.
And I just bring my experience and teach the students and stuff.
Nice.
Yeah.
Yeah, it's a very good point about not treating the injury or the symptoms, but more the root of the problem, right?
Correct.
Yeah, it's a very important thing, and you know, we talk about hamstrings, for example. It could be due to the back,
or can be due to your pelvis, that sort of thing.
Nice. Now, obviously with your masters and what have you, right? But let's go back to your working, experience and stuff like that.
Okay.
Right, and we go to Mount Alvernia because this is very interesting. You were at Mount Alvernia Sports Physiotherapy Services, right?
Yep.
And you were the senior sports physiotherapist there.
Yep.
And that was also the main hospital till about 2010, where the S-League players go to for rehab and for recovery and for treatment and stuff like that. And obviously now it's called the SPL. Now, take us through what happens when, for example, I'm a player from Club A, walks into the door, I get registered. What happens if, for example, I've got an injury? What happens? Take us through the process at Mount A.
Okay. At the time, usually when you have when a player comes in with an injury, they will see the doctor first. Okay. So they will see Dr. To, and then Dr. To will diagnose the issues, and then they will go down to the physio department, and that's where we start the rehab. Okay. And of course, before that, maybe they will do some X-ray or MRI if they need to.
Right.
And then they'll come in every day, and then we'll treat them. And at that time, I think it was the insurance was NTUC income, and we actually do help the clubs by doing direct billing to the insurance themselves. So clubs don't do anything; they just send the players, and then we just make sure that the players get back to the fit as fast as possible.
So basically, you see the doctor. The doctor will to diagnose, for example, a hamstring tear, grade 3 hamstring tear, and then it goes to
the physio department.
And that's where the physio department will do the rehab, the necessary rehab and stuff like that, over depending on how long it goes, right? Now that's how it works usually, and I think that's basically how it goes, obviously with the X-rays and stuff like that. Now let's talk about the S-League today, or not today, when you were treating them, and obviously
at that time.
At that time, when during your time, right, at Mount A, and I think lots of SPL players or the S-League players who are listening to this will find this interesting, right? Based on your experience, what is the most common injuries for footballers?
Okay, at that time, I think initially, we do see a lot of ankle sprain. We do see at that time already a lot of ACL injury.
ACL.
Yeah, ACL injury, MCL injury. But when AstroTurf starts to come about, we start to see more back pain.
Really?
Yes, more hamstring strain.
Okay.
Yeah, so this is what I can remember of. And not only just the normal knee sprains, ankle sprains, but we're seeing a lot of cases of back sprain and
So it's basically ankle. I mean, it's quite common.
knee.
ACL,
Yes.
right? And then back problems with the AstroTurf.
Yes.
Wow, this is interesting because I thought that with with the AstroTurf coming in, it will be more hard on the ligaments with the knees and stuff like that. So,
Yep.
yeah.
But ligaments injury doesn't. There must be a pivoting or.
Right. True.
Or when one leg is stuck to the ground, the other your body is twisted, that kind of thing. So it's not really the ground stuff. Because I kind of know, like, at that time there's a stadium in the east.
Okay.
Because near the goalpost is a little bit bumpy, or it's not
near
so.
the east. Okay.
Yes. Okay.
Right.
And then a lot of players were getting ACL injuries at that time,
Ah.
at that stadium,
I know
at
the
that
stadium.
area.
Right.
Okay. But when it comes to artificial turf, okay, I think we are seeing more back strain, back pain, and hamstring strain because of the loading.
Okay.
Because of the hard surfaces and the jumping and running and stuff.
Right.
So if their cores are not so strong, they are more prone to all this back strain.
Nice.
Yeah.
You talk about ACL and stuff, right? Now, what is the worst injury you have treated or seen besides the ACL in terms of our footballers? Besides the ACL.
Beside the ACL, I think as the players age a little bit, okay, you start to see a lot of degeneration of cartilage in the knee.
Okay.
Okay. So wear and tear, and they are actually very young at that time because they are only about maybe early 30s.
Okay.
But because they play too much football, okay, so the cartilage are severely damaged.
Right.
And then they try to harvest, they try to do like injections and all that, but once it's gone, it's a little bit difficult for the cartilage to grow again. Okay, and then you will have bone and bone rubbing with each other.
True.
And then I think that's probably signal the end of your playing time.
Wow, that's very sad, Fairuuz.
Yes.
Cartilage, right?
Yes, cartilage.
Because I know, I think I have a friend who's actually had done this, the harvesting of cartilage.
Right.
So it's not the same anymore, isn't it?
It's not the same anymore.
Wow.
Yes.
Right.
Nothing beats the original. That's what I always say.
Of course. But obviously, the ACL injuries have been is probably one of the worst as well.
That's right.
And I'm sure you've had many experiences with treating them.
Yes, and then I mean as a footballer you should also know that sometimes after you go through your ACL reconstruction, you are not the same player again.
Okay.
You are not the same player again. Okay. There's always the fear,
right,
and of going all out, and there's always a fear that your knee. You might damage it again, and then if there's a few players who have done multiple surgery, multiple ACL on one knee.
And questions keep racing to my mind as you are saying this, because there are the opposites as well. Some people have gotten better after doing the ACL injury, gotten stronger, right?
Yes.
Why is this so?
I think for this group of people, their rehab is very important. Okay.
So they've done a proper, more
detailed, more proper rehab, and they get their muscles to be strong enough. Okay, to become the secondary support or secondary stabilizer. So they don't really depend on the ligament. They actually just strengthen up their muscles. Muscles are strong, so they can actually play, and they can actually endure the rigorous game.
Which or how fast has been the fastest recovery in terms of ACL in your experience, right? Treating how fast?
I think before we go into that, I think standard wise, it takes about 9 months. Okay, and then on average 9 months before you can start going back to maybe full training again.
That is from the time surgery is done?
Surgery, yes. Okay. But I think the fastest that we have got, but maybe we shouldn't consider him because he's a goalkeeper.
Right.
So he went for surgery, and 6 months after he starts playing again.
Playing as in started playing?
Yes.
Who is this? Hassan?
No. There is one Tampines player, old one. I can't remember. Goalkeeper.
Right.
Yeah.
Okay.
So it just go off my hand. But he actually goes back very fast, and he plays at 6 months after surgery.
How about an outfield player, fastest?
I think Normally it's about 9 months to 1 year. Okay.
Wow. Okay.
And that was me before my masters. Okay. But I think now with all the experience that I have, I will always tell the players that we have to be safe. Okay. We have to be safe, and the safest is to go back at 9 months to start maybe playing again. But of course, at 6 months, 7, 8 months, you can start training and stuff. Yes. But going full force again at probably 9 months to 1 year.
Interesting.
Because I mean, studies have shows that you have 50% chances of rupturing your graft again if you go back to play 9 months or before.
Wow.
Yeah.
Studies,
research. Yeah.
Okay, players, now you know, right? Don't go crazy. And have you watched this the Roberto Baggio movie on Netflix?
No.
He was crazy because he wanted to play in the World Cup. He got back like I don't know, less than 5 months or something. He's just, you know, but that's different, right?
That's different.
Now, you've treated foreign and local ones because obviously their insurance covers them, right? Are there any differences in terms of I don't know, could be in terms of recovery times? Do you feel so? In terms of attitude in the recovery, is there any difference, local and foreign players?
I don't think there's much difference.
Okay.
But of course, not all locals are the same. Not all foreign players are the same.
Right.
Okay.
Right.
You may have local players who are very hardworking, who are very passionate.
Right.
Okay. And I think one of the reason why they are really wants to go back into fitness and getting play time again after surgery is because it's their rice bowl.
Correct.
Okay. So, and some of them, if let's say you were injured in the middle of the season, okay, you really wants to get back fast so that you can secure a contract for the next season.
Very good point.
Or you actually get some other clubs trying to give you a contract. So I think it doesn't matter whether it's local or foreign players. We do also have foreign players who once they get injured, they don't want to play. They are better, but because they don't want to train, but they just want to play. So they try to
they try to time their injuries.
They time their recovery and to go back to playing again.
Right.
So I think there's not much difference in that. But there's a lot of experience. There's a lot of stories with players and stuff.
It's a good point, especially about the contracts, right?
Yes.
Because you're very right. Because sometimes I'm maybe my last year with the club, and I get injured at a crucial time, then you're not sure whether next year you'll be around. True. I need to play to show to prove. It's a very good point. I can understand.
And if I can share, like most of our players, I'm not sure now, but at that time, they don't have any good educational background. So the only way for them to to survive is to play soccer.
True.
Okay, and that's where they probably don't have something else to fall back on.
Yeah.
So they just wants to actually get better faster.
What makes you angry when you're treating a player? I wanted to ask you not who, as in without mentioning names. I wanted to ask you, what is the worst kind of players you would treat, right? So what makes you angry when you're treating a player sometimes?
I think we have to follow the natural pathways of healing. Okay.
Right.
So for example, you just gone through for your ACL injury.
Okay.
And we have the protocols that no jogging until you reach your 3rd month.
Right.
Okay. But some players, they say, no, I didn't jog, but I just play at the basketball court and all that. Yes, because they just want to kick around. And you know that even though your muscles are strong and stuff, but inside it's not healing properly yet. Okay, so that's really sometimes anger you because you have been working with them for months, and then just towards the end they just try to be a little bit more,
Has it occurred like you treated the player and then you've given them good advice and then they don't take your advice at that crucial point and then they aggravate
damage it? Yes, there is. Yes, we see a few cases. I see a few cases where they don't follow the protocols, and we say don't run, but they run.
So what do you do then? What would you tell the player then? Obviously it's not your loss, right?
Yes.
Because it's his loss,
right?
Because he can't play. But what do you personally, what do you tell? I will get crazy, man.
I mean, of course, we at that time we were probably a bit angry with them.
Yeah.
But I think the best way is to educate them.
Right.
And then talk to their senses and tell them that what you do is wrong.
Yeah.
Okay, if you do this, this is gonna happen. Okay, and it's gonna get worse and worse. And then it's not worth it because you are aiming for your contracts. You want to start playing again. True. And that kind of stuff.
Nice. So players, if you are undergoing physiotherapy, please stick to the plan. Don't go crazy.
Stick to the plan.
That is, the wise words of Mr. Fairuuz. Now, you have treated some of the big names in football here.
Yep.
You made good friends, especially
Yep.
with some of them, and I've seen photos of you with some of the legends. But has any players tried to tell you, okay, I'm ready to play, when they are clearly not? Right? Have they?
Yeah. I think sometimes it's not only the players. Sometimes the coaches will call me and say that I really need him for the game. Maybe it's important
what do you do?
game. Okay. I mean, to be frank, I have to be professional. Okay, I have to tell the coaches, even the players, that you are at this stage of your recovery. Okay, if you go out and play, okay, you have the risk of making it worse, or you have the risk or actually injured some other parts.
Yeah.
Okay, so I think the important thing is for them to trust the physio. You must have a good conversation with them.
Yeah.
Not only the players but the coach. But knowing Singapore, at the end of the day, okay, the coach will decide whether to play the players or not.
Yep.
Okay, I think last year we just have, not mentioning clubs or players, the players just get back from muscle injury.
Okay.
And then it's only like 1 week where even a strain at least takes 2 weeks before you can start playing again. But I think player was really wants to play and all that. He played. I was surprised because I was watching the game. He was substitute. Okay, I mean he was at the bench and then they
he went
him.
in. Yeah.
He went in. Less than 2 minutes.
Oh.
He came out again.
Muscle, obviously the same
Because
muscle.
he pulled the same muscle again.
Right.
Yeah. So, I think we have to be professional to tell the coaches and the players what we think, and at the end of the day, okay, if they want to take the risk, is for them to take.
How does this work, right? Okay, let's say now the player comes to you with a hamstring injury. You've been treating him for 2 weeks, 3 weeks, and then do you sign off on it and says he's ready to go, or the doctor signs off?
Okay.
Who does the?
Most of the time, we will allow the doctors to say whether they can play or not.
Okay.
Okay.
Right.
But sometimes the coaches and the players also get our input.
Okay.
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 And we will also tell our input to the doctors.
Okay.
Okay. But sometimes it's actually a direct thing between the physios and the players.
Okay.
And and the team.
Right.
So they actually just depend on us because we are seeing the players every day, day in and day out. And I think we know better whether the players can play or not.
Right. And listen, I have been a player.
Yep.
Obviously, I haven't been a physio, but I've been a player, been injured. I've been on the other side as a coach as well.
Yes.
So I know what is in the head sometimes.
Yep.
Obviously, in the players and on the coach's side as well. So I understand, but at the same time, I think the common sense must prevail.
Yep.
Because sometimes you feel like you're okay, but it's not.
Yes.
On the player side.
Yep.
Now, on the coach's side, you want to win games.
Yes.
You want to get the 3 points so that you don't get sacked at the end of the season. Along those lines. So, and you want your best players to play. So, you can understand, but I think for the good of the players' health and their physical well-being as well, I think you gotta follow protocols as well.
True.
And be professional as well, because I know, especially with muscle injuries, because touch wood, I haven't had any ligament problems in terms of the knee or whatever, but muscle problems, it's very, very tricky,
delicate,
because you feel that after 2 weeks you are okay, and then you go and you make just one, and then that's it, gone. I've experienced. So players, I think you really got to know yourself first, and then you got to know the nature of the problem, especially with muscle injuries. There you go. Now, You see the role of a physio in a team environment.
Yes.
Quite a lot, right? In terms of football and what have you. What is your relationship like with the coaching and technical staff? And most often than not, there must be a little bit of trust, right, between you and the coaches.
Mm-hmm.
Do you have the trust?
Before, I think long ago, I was helping with the Prime League.
Okay.
But that was at Sembawang Rangers.
Yes.
The old Sembawang Rangers.
Nice. Okay.
Yeah. So at that moment, I'm still a young physio. Okay, I'm still a young physio. So yes, you tell them and that, but being young, the coach usually makes the whole. Yeah. Okay. But I think I was fortunate enough to actually help the Singapore SEA Games soccer squad.
Nice.
For 2015 and 2017, and I think
who was the coach there?
2015 was ID Skandar,
right.
And then 2017 was Richard Tadi.
Right. Okay.
Yeah. So and I think because of my experience and what I've not, they actually trust my
your judgment
and my what I told them, and I think is I work very well with all these coaches.
Nice. It's good, and I think the trust is important as well. Yes. Now I want to ask you this, right? The Singapore Professional League is in its 25th year this year.
Yep.
If I have done my maths right.
Yes.
At the moment, from your knowledge, has any club engaged a full-time physiotherapist? I think LCS has just.
Yes. LCS just hire physio.
Correct, physio.
But I think some athlete clubs actually hire part-time physios now.
Okay.
And which to me is good. Okay. But I think we have to move forward.
Right.
Okay.
Right.
To be more professional, I think every club has to have or hired a full-time physiotherapist, and this will really helps in the players management of injuries management and stuff.
Right.
Which we have not seen this. I mean, I told you just now when I was in Melbourne, so in 2009, the A team has 2 physiotherapists and a few sports trainer, and I think going forward this should be how it is for SPL clubs.
True. Very, very true indeed.
Yeah.
Now, we talk about injuries. How about prevention?
Okay.
Because what do players really need to do for prevention of injuries? Is there a way? Maybe I don't want. Obviously, which player wants to get injured, right?
Right.
So is there a way, like maybe a player can do something? I don't know. Besides praying every day.
Okay. I think pre-season is very important.
Yes.
Okay. So you have the coaches, the strength fitness coaches working with the players pre-season. And I think it should not be just pre-season.
Okay.
It should also be done mid-season.
Okay.
Okay, so that they are actually fresh throughout the season.
Nice.
Okay. But the most important thing I think is recovery.
Okay.
Okay.
From games.
From trainings. Okay. They must know how to recover well. Okay. One important thing is sleep. Okay. Does these players have a good night's sleep? Does they sleep well?
Okay.
That kind of thing.
Okay.
And sadly enough, I mean, if you know, I know, some of these players are not being paid very well in S-League, and they have some other jobs outside. Okay. And this can actually take a toll in their physical health, in their mental health. So they need to know how to take care of themselves. Sleep, as I said, ice bath, ice compression therapy, good nutrition. Okay, and I think moving forward, if the players themselves know how to take care of themselves, they can actually last longer in the game.
Right. Last longer in the game as well as their career as well.
Yes, that's right.
Good point. Sleep, right? Sleep,
Sleep is very important. And then now, every time everybody is on the phone, Netflix. Playing games, Netflix and stuff. Yes.
Now,
so this is something I think future coaches, coaches now, not future coaches, coaches now with their future players, those from the age of 12 onwards, you have to actually instill in the players this kind of attitude.
Nice.
Taking care of their body, taking care of themselves.
Beautiful. Now, if you've treated not only footballers, right? Obviously, you've treated footballers and other athletes, right?
Yep.
Do you see any difference in terms of mindset of these players in recovery phase? No.
Same.
Yeah.
Okay, but I think it's also got to do with what sports you are in.
Right.
The support that you have. Okay.
Okay.
So, for example, I was working part-time before at St. Andrew's school.
Okay.
And they are very into rugby.
Okay.
Right, okay. And these players are these teenagers are very tough. They are very passionate about rugby.
Yeah.
And they do everything that the coaches do.
Okay.
And they recovered well. Okay, but I also work with some tennis player.
Right.
Okay. Tennis players a bit different because if they are into it, they have very good support from their family members.
Okay.
So they can come in every day just for therapy, for rehab, for recovery and stuff, and they have good support lah. I think this is something for soccer especially. We must have everybody come in, chip in to give everything good support to the players. Yeah.
I think it's the culture as well.
True.
I think it has to do with that as well.
Yeah.
And I just want to add this, right? Has technology in physiotherapy changed over the years?
Yes, of course. Okay.
Right.
Now there's a lot of machines and stuff that we do for recovery. Okay, for example, we have ice compression therapy. In my clinic, we have the Med for Elite.
Okay.
It's ice compression therapy where you don't use ice, so it's just actually machine we put in water and then it actually can cool up everything. And we also have what we call the Alter G, the anti-gravity treadmill.
Wow.
So we have not seen this before in earlier part of my working life.
Yeah.
So we actually can get players or clients who have knee pain or surgery to start running again. Okay, so start jogging again at a lower body weight.
Wow.
So it's a NASA technology where they actually pump
You
out
have
the
this?
Yeah, we have in the clinic. So
how much does that cost, by the way?
it's about 85,000. Yep. So but some some athletes, some especially triathletes, they really wants to get faster. They really want to start running again.
Okay.
But of course we can start them to run, but at lower body weight. For example, they weigh about 60 kg. We can start them to run at 30 kg.
So that means what they don't have full pressure on their limbs?
They don't have full weight on their limbs because they are raised by air. Just like like walking in the moon.
So in a way, technology has evolved obviously and helped them to probably recover faster.
Yes, of course.
Wonderful, brilliant. The pandemic, has it changed
Oh.
how you guys are treating athletes? Any Zoom sessions? It's crazy, man.
Yes, I think last year when COVID starts to hit Singapore and stuff, so we'll asked to close for a few months, and I think we start encouraged to do some Zoom session. But of course it's totally different, because I can't diagnose a person injury just by asking question and stuff. I have to do my assessment. I have to put my hands on the limbs and joints. So I hope these COVID things will end very soon so that we can get more people to come in here.
It's obviously, especially in this business, because you really need to see, feel, and even manipulate the limbs and see what's happening,
That's right.
Well, Fairuuz, right now, right, you are a clinical director at PhysioSports Pte Ltd, and obviously you left Mount Avenir like in 2014, right? And you went to do this privately, right? What made you do this, as in go on your own?
I think one thing is you want to do things. You know what are the things that you want to do, what are the right things to do, and you don't want to have many red tapes.
Give me one example of a red tape. Just one example.
Okay, for example, like when I was working in the hospital, patients cannot see me direct.
Okay.
they must have a referral letter from any doctors.
Okay.
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 But now, because I'm in the private clinic, okay, I can see the patients directly first
and diagnose the problem.
Okay. So this is what we call first contact.
Nice.
Okay. And in Australia, this is already going on for years. So people don't go and see the doctor when they have back pain or they sprain the ankle.
Right.
Okay, they will see the physio straight. Okay.
Right.
Number one is save the cost.
True.
But number two, the physio must be good enough to diagnose the problems.
Of course.
And if you know that something is not right, or if you know that they need more medical attention, you refer them back to the doctor.
Okay.
Okay.
So that's an example of a red tape. Okay.
Yeah.
Okay.
So and just recently we have a case. Okay. A player came in. Okay, and then have a swelling at the calf.
Okay.
Okay. So normally club was saying that okay, that's probably a calf strain and all that. Okay, but on testing, okay, the players it's more than a calf strain, because when we work on the muscles, it's not reproducing the pain, but the players have swelling and stuff.
Okay.
And the players actually went for the MRI in the morning and came to see us. And then while was at the clinic, I asked them, you better get the doctor to tell you, the radiologist to tell you what's the MRI result. And true enough, there's a blood clot in the vein. Okay. And this is what we call deep vein thrombosis. Okay. And the players wanted to just go home and see the doctor again the next morning.
Okay.
But I told them, no, you have to go to the hospital now.
Okay.
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 So I told him not to walk on the leg. I give him a pair of crutches, go to the hospital straight away. And true enough, when he go to the hospital, the doctor was telling him, you are lucky that you come earlier, because if this thrombose or in the vein actually ruptured or moved out to other parts of the heart or the brain, you will it's a life-threatening condition.
Okay.
Yeah. So I think when you are in private practice, okay, you have to be very good. You have to know all the not only just like looking at a calf strain, you must think of other things and advise accordingly.
In a way, your responsibility is higher.
Yes.
Because you are then doing the work of the doctor as well, because you need to diagnose, right?
Yes.
Wow. So how has it been? Struggles in terms of were there any struggles so far? You take away the pandemic, obviously that's a struggle on its own.
I think I think now the struggle is to actually get. I'm already in this business for 23, 24 years.
Yes.
So to get a younger physios to
work with you,
to work with me, to learn from me, and to eventually not replace me, but take over.
No. So what's the struggle? Getting them in, or to get quality ones in? Which is?
I mean, of course, everybody starts somewhere.
Right.
Okay.
Right.
But I think going into physio, okay, it will not make you rich.
Okay.
So if you want to be a rich person, okay, forget it. Okay, don't be a physio. Okay, it's a lot of hard work. Okay, to be good, to be where you are, you have to be passionate. You have to work very hard. And I think the other important thing, okay, is to have a good interpersonal skills.
Nice.
Okay, so this is what we always learn when we are in the hospital. You can be a good doctor, you can be a good physio, but if your bedside manners is not so good, okay, you won't win the heart of the patient.
Wow. Nice.
So this is something that, I think at this moment I'm trying to groom new physios. Okay, to be as good as me, if not better. Yeah.
You are the master physio. How many do you have right now at the moment?
At the moment, okay, because I only have one younger physios working alongside me.
Right.
Yeah.
Is he or she good?
Clinically, she's very good.
Nice.
Okay, but I think I just have to groom her.
Obviously, it's about experience, right?
Yes, that's right.
Nice. And just, how can people reach you, Fairuuz? Come on, market yourself now.
I mean, we are on Instagram, we are on Facebook. PhysioSports.
PhysioSports, right?
SG.
Yep.
Yeah, okay. Or you can go to our website, www.physiosportssg.com.
Nice.
Yeah.
And just one word of advice. If let's say I am, I mean, you already mentioned about passion and hard work and stuff like that. Obviously, that's very important, right?
Yep.
Let's say right now I want to be a physio.
Yep.
I just finished, like I said, maybe
SIT?
bachelor's, right?
Yeah.
I've gotten a bachelor. What should I be doing right now? Obviously I have the passion. I'm probably hardworking and whatever. What should I be doing right now? I've already gotten my bachelor's.
This is my advice, especially to all the young physios. If you just have your bachelor degree or you just pass out from your education, I mean from studying, I think the best way for you to gain experience is to work in the hospital. Okay, that's where you will see a lot of cases. That's where you will see same injuries day in day out. You see other injuries, okay, and that's where you learn, okay, because sometimes when I was working in the hospital, we were following the doctors for their ward rounds. So from there we learn a lot of things from all the seniors doctors, the consultants. So my take is that, learn, go and expose yourself, experience in the hospital settings where you're going to see a lot of patients, and only then, okay, after 5-6 years, okay, where you already gain more experience, you can venture out into whatever specialty you want to do.
Right, nice. Very good advice there. Mr. Fairuuz, thank you so much for being on this episode of this podcast.
Thank you so much for inviting me, Shashi.
No problems. And I think it is a very good episode, especially I haven't gotten a physiotherapist before in my podcast, so this is the very first. And thank you so much for being here. I think for those of you out there at home who are listening in, players, athletes as well, you know what to do. Don't go crazy. Relax a little bit, listen to good advice. And obviously for those of you who wants to be a physiotherapy, you got to start at the hospitals, do your due diligence and stuff like that. This has been episode number 53 of the Silverfox Hustle podcast. Don't forget to follow us on YouTube, on Spotify, on Apple Podcasts and the other podcast platforms. Till the next episode, the hustle beats talent when talent doesn't hustle. Cheers.